Across the country, athletes are training hard for marathons and other activities. Sudden cardiac death is common among many young athletes involved in college sports who are unaware that they may have a genetic cardiac disorder called hypertrophic cardiomyopathy. 1 in 500 people are diagnosed with HCM. HCM is a heart condition where the heart muscle thickens abnormally. This thickening can occur in different parts of the heart, but usually occurs within the left ventricle and the ventricular septum, which is the area of the heart that separates the right side from the left side of the heart. And this may interfere with the normal functioning of the heart by narrowing the outflow of blood. Most individuals are unaware of their condition because the disease, in most cases, is asymptomatic. A common way to find out that the condition even exists, as stated earlier, is usually sudden cardiac arrest or symptoms induced by strenuous activities, such as breathing that is heavier than normal and can hinder the activities of everyday life.
While physiologically HCM affects the heart, it is also important to assess the psychosocial effects on these individuals. Triggering symptoms of chest pain, dyspnea, palpitations, and shortness of breath by emotional stress is also common with HCM. Previous research done on HCM patients ages 8 to 18 indicates that patients fear the possibility of sudden death and also feel alienated from their peers by their disease. Increased stress levels due to these factors can have devastating impacts on a patient's overall health. In order to evaluate the level of stress and anxiety of HCM patients who are apprehensive about their disease, an experiment was performed to measure the level of stress that each researcher's heart endured on a daily basis by wearing a Holter monitor. A 45-question student stress scale test was specifically designed with questions regarding the negative states of psychological and social stress brought upon by wearing the Holter monitor. Each question response was based on the frequency of stress: 0 never, 1 seldom, 2 often, and 3 regular. This test was given to each researcher as a pretest before he or she wore the Holter monitor, and then as a post-test after having worn the monitor in each 24-hour trial period. It was projected that stress levels would increase while wearing the Holter monitors due to the hassle of carrying them around, putting them on in the morning before school and work, and triggering negative attention to ourselves from peers, along with the stress from school, work, and relationships. The daily stress conditions were not set up to worsen over time, but were constructed upon tiresome random events occurring on a daily routine. In addition, in one of the trials, the heart rate was monitored over a 24-hour period. It displayed elevated heart rates during increased stress phases. Let's hear from one of our researchers and his experience with the Holter monitor.
I didn't really feel like it impacted my daily routine that much. It was just kind of annoying, but it wasn't really that difficult to deal with.
On an average of 6 trials, the increased stress of the researchers was revealed by the rise in the post-test score. T-test analysis determined no significance between pre-test and post-test scores of all researchers with an average p-value of 0.40. This illustrated that the heart monitor along with the daily stress routines did not add further stress upon any of the researchers. Evaluation of the researchers' pre-test and post-test scores provides implication that Holter monitors do not diminish the quality of life in hypertrophic cardiomyopathy patients.